Welcome to this episode of ECGs Made Simple. Now, if you're just stumbling across this video, make sure you subscribe and check out the other episodes. With that out of the way, let's get started. Okay, so what do we have here? Well, this is a completely new rhythm. Let's start with the rate. We got 1, 2, 3, 4, 5, 6, 7, 8 times 2. So we got a rate of 160. This cat is cooking. So let's check to see how regular this rhythm is. Well, looks pretty good. We'll call that regular. So are the P waves present and upright? Well, yeah, they are present, but you can see where they're merging into that T wave. That's very common in these super fast rhythms because as soon as the heart is reset, it starts over in another cycle and you start getting this merging or that camelback between the T wave and the P wave. But they are present, and there is one for every QRS. Now, let's measure the QRS, shall we? And it looks like we are really close to 3 small blocks. I'm going to call that 2.75. Again, don't get hung up on the exact size, as long as we're under 3, which it is definitely under 3. So we'll call that 0.12. And that's just because we rounded up. As long as we're less than 0.12, we're good. But we'll go ahead and call that 0.12. Now we'll measure that PRI. It's pretty short, and that's very common in these rapid rhythms. So 2 small blocks, so we're looking at 0.08. Now, the rhythm you're looking at is actually kind of a trash can term for a lot of different rhythms. And there's a lot of different causes. It's called SVT, or supraventricular tachycardia. Now, pay attention to that name, supra, above the ventricles. Now, there's a lot of causes for it. It shouldn't be mistaken with sinus tach, and I'll kind of break that down in a little bit. But this is different than a chronotropic response to exercise or hypovolemia. So to diagnose these patients with SVT, we got to take a good look at their history. If somebody's at the gym and has a heart rate of 160, that's acceptable. If somebody's blood pressure is starting to decrease, and this is again a chronotropic response, that's acceptable. But if they were sitting there watching Jeopardy, well, that 160 starts to seem a little fast. Another little tool you can use is your maximum tachycardia. Now, this isn't an exact number, but it's a roundabout. And you take 220 minus the age, and that anything above that number, if you don't have a cause for it, is probably due to SVT. So let's take a look at what's going on in the heart. Now, a common cause of SVT is a looping of the electricity through the atria. So an impulse is created and it works its way down to the AV node, but in the meantime, another impulse is created. And they start circling through the atria. And as they circle through the atria, they're ringing the AV node, and the AV node is sending out as many of those beats as they can. This creates those super rapid rates that we see in SVT. Now, SVT is a lot more complicated than I'm explaining here, but now at least you can identify the rhythm. Just remember to differentiate between SVT and sinus tachycardia. You need to incorporate the patient's history. We did it, and it wasn't that complicated, was it? We went through all of the rhythms, or at least all of the common rhythms that are initiated in the SA node and the atria. In the next video, we're going to cover junctional rhythms and AV blocks. But I've really enjoyed making this video. Please give me some feedback before we make that next video. Let me know if there's something you like or something you didn't like. But until then, be safe. And that's it for this episode of ECGs Made Easy. Now, to catch our other episodes, go ahead and click right here, and I'll see you over there.